Good afternoon, everybody. Good afternoon. It's welcome. All right, it's a little Sunday Funday with Joe. So you guys are in the ultimate nucleus of my brain, guys. You're in my garage. This is as good as it gets, guys. You're in my garage. So let me give you a little tour. So there's my widescreen TV. It's my couch sitting here. This is where I do my charts when I wake up, right? Over there in the corner there, guys, that's actually a kegerator there. I actually have Corona in there. So if you can't beat the virus, you join it, right? So that's what I do, right? So here's my little pleasure. And then out the front we go. There's my cars. That's my right. That's my front. So this is as good as it gets, guys. You've got me sitting here on my couch in my garage, guys. This is as good as it gets. So listen, one of the things we decided to do at Smarty Pants was this. We decided, let's just have a Sunday a couple times a month. Let's go over a subject everybody hates, and let's just have fun with it. So in other words, instead of like sitting down and studying for 2 or 3 hours, just like, let's just have a little fun. Let's just talk about something, 30 minutes, just discuss it and kind of have an idea of what we're doing, right, guys? And I know everybody hates hepatitis. You just bring up hepatitis questions and everybody just goes, it's like, I'm telling you, let me show you how well I know students. You ready? Watch. You ready? What do students hate? Students hate heart murmurs, blood gases, EKGs, anything to do with hematology, and just mention hepatitis, and you guys just crumble. You're like, oh no, I can't do this, right? So I get it, guys. I get it. I know you better than you know yourself. That's the whole irony to this. I've been teaching for 30 years, so I know students so well, guys, so well. All right. So before we can go down the hepatitis question here, what I want to do real quick here, so I'm going to share my screen with you guys here, okay? So what I want to do is this, guys, is what I really want to do is I want to take a look at just Immunology 101. We'll make this quick. But I really want you guys to look at this from a perspective like, okay, this is what Joe's talking, because this is going to come so much into play, guys, when we start talking about, which auto antibodies to work, right? Does that make sense to everybody? Okay, so let's just go to this real quick. All right, so what do I need to know? So, the immune body, when we make antibodies, right, it's just our body's response. It's whether it's to a virus, a bacteria, it could be to a fungi, but this is what our body does. It's going to respond. It's going to do something, right? It's going to do something. It's what it's going to do. So what I need you guys to do is just kind of understand, all right, my body's going to put up a response, right? It's what it's going to do. IgM. So who's IgM? I always say M stands for military. These are the guys who are coming to kill you. So when you have an acute infection, you got acute hepatitis A, acute hepatitis B, acute hepatitis C, you have an acute strep throat, you have acute pneumococcal pneumonia, you have acute chlamydia pneumonia, you have acute anything. Who's showing up? The military. What are you doing? Fighting. What do you got? I got an infection. I'm going to fight. So it could be acute fungal infection. It could be acute viral infection. In the beginning, guys, one of the things we did, I work in the emergency room, and, so I've been dancing with COVID for the last 2 years. And one of the things we knew is that we started doing the antibody test. And we kind of figured out how bad was the response. And this is what we started realizing when people were not mounting a response, were the people that we're most worried about. So when they put a response, you're like, good for you, you're going to fight. So who shows up first, guys? The military. So the next question you have to ask yourself, okay, if the military shows up first, Joe, I see your point. So there's the military, got acute Hep A, acute Hep B. Who's showing up first? IgM. So what happens in 2 to 3 months? Good question. Well, all my military guys turn to good guys. So IgG, they're good guys. Dude, they're your BFFs. They're best friends for the rest of your life. So now you've got these best friends. You get it? They're with you for the rest of your life. Now, one of the things about the good guys is that they can cross the placenta. They're good. So they can go across the fetus. They can cross the placenta membrane. You know that question you always see about the HIV positive mom and what you order on the neonate? Now does everybody understand? If it's IgG and that mom had HIV, so what'd she have in the initial, guys? IgM. But now what does she have? Well, it's 2 months later, Joe, she's got IgGs. Exactly. So wait a second, it's a good guy. So we can cross the placenta and play with the fetus. Exactly. So my fetus is going to be HIV positive. Exactly, which means it's a worthless test, guys. Get it? It's a worthless test on a neonate. So now what I'm really trying to share with you guys is this, is that, hey, what I need to understand is that I got these good guys. That's all. Got it. So does everybody see the M's to the G's? Because this is going to help us out the most now, right? This is going to help us out the most, right? When we start talking about hepatitis, right? And then of course we have IgEs. What do you guys learn in school? That stands for eosinophils, right? And allergic processes. And then the last thing that we had down here that, right, is this IgA, right? And that's this airway and abdomen and asthma, right? We see those. But what I really want to get back to is the M's and the G's. Do you understand the difference? So the M is like, you're right, Joe. We're fighting like right now. What's the G? Well, it's 2 to 3 months later, and my military guys turn to good guys. If we can keep that together, guys, we're going to sail through this, okay? Because this is what I know you guys hate, right? Everybody hates this, right? Everybody hates this. All right. So what I need inside of you is just like, okay, so hepatitis, right? It goes to the liver. And can we all agree, just foundationally, can we all agree that your liver is an ultimate filter? It's the best. I always say you have 2 filters in your bodies, guys. You've got liver and kidneys. They filter everything. So can we all agree, just foundationally, if your liver is out and doesn't work, can we agree that you don't filter well? Can we all have that agreement? All right. When you break down red blood cells, one of the byproducts is bilirubin. Well, where's it going? To the liver. But wait a second, the liver doesn't work. Exactly. So what's going to happen? Oh, the bilirubin is going to start to accumulate. So we'll get to that. But does everybody see the concept? This is what I need. So you have to understand, when you say the word hepatitis, you're like, hey, Joe, I've got problems here, right? I got a liver that's not working. So let's go down this path together. Hep A. So Hep A, okay, is a very small virus, RNA virus, and that's how it looks, right? For you guys, right? For your little virology geeks, that's what this is looking like. So how does Hep A happen? So it's fecal oral, right? So it's a fecal oral thing is what happens. So this is usually transmitted through food, right? So this is, so this is why we see it in like these camps and stuff like that. So you'll see this, a lot of times in these, you get these explosive epidemics seen in daycare, military camps, stuff like that. So it's eating. So you and I have eaten it is what happens. Okay, watch this. Watch how much you already know. Hi, I have acute hepatitis A. So who showed up first? IgMs. What's going to show up 2 to 3 months later? IgGs. So now does everybody see how the board question can be manifested? And they're going to say, hi, you got a person who's jaundiced that you suspect has hepatitis A. Which of the following lab results would you like to order? And you're like, okay, if it's acute, it's game time, then I'm going to be looking for hepatitis, I'm going to look for IgM. Exactly. It's exactly what I'm going to do. And then, of course, what do we do when we have people who are exposed to it, right? So we can give them either the immunoglobulin, right? And then we can get the vaccine. So you'll see, guys, that academically today, 2022, what's the right answer? Oh, it's the immunoglobulin. But here's the point. This is what I want people to understand. Say the right question, what's the immunoglobulin? Good question, isn't it? So let's answer it. You see, guys, when I give you immunoglobulin, I'm giving you IgG. No, I am giving you somebody's good guy. I either genetically make it, sometimes we get it from horses, things like that. So I get, or sometimes from other humans, right? Does everybody see this? It's like, so I'm borrowing somebody's good guy. But here's the right question. If I borrow somebody's good guy, in other words, I didn't make it, somebody else did. Maybe I made it in the lab, heck, I don't know. Who knows? But I made it, but I gave it to you. Does it last in you for a lifetime? And what's the answer, guys? No. You see, when you borrow somebody, when you don't make your own good guys, you borrow it, it doesn't last forever. So now does everybody see why people are talking about, why don't you just vaccinate for Hep A? So you'll see there's this argument going out there in the real world. When you get out there, people will argue about this, going, well, you really want to give the immunoglobulin, why don't we just vaccinate them? Because they'll mount a response. There's your IgMs. And then they'll make their own IgGs and they'll be good for life. Does everybody see this, guys? And immunoglobulin is god awful expensive, guys. My God, when you give immunoglobulin, it's like you're talking, it's well over $1,000, guys. How much does it cost for Hep A vaccination? I think it's like $25. So does everybody see the finance to this? Does everybody see this? And this is what we're going to see, guys, in the real world. Okay, so that's Hep A. So now I want to ask you another question. This is the one everybody hates. I know you hate this one. This is the Hep B question, and I know you hate it. And we're going to tie all this together at the end, because trust me, they all have something in common. So this is the Hep B. This is one we hate. All right, guys, I've learned that what students do is they like stories. So let's learn a story about Hep B. So how do I get Hep B? So I get Hep B through IV drug abuse. Sexual contact is how I get it. Guys, this is the most common ways to get it. And guys, if you were to look at it statistically, if you were to really pull back, who runs the show? Make no mistake, guys, it's IV drug abusers. They run the show, right? The sexual contact thing, to be honest with you, there's a lot of argument among the epidemiologists about this. They really think this is an IV drug abuser who's having sexual contact with another person. That other person's the one that ends up getting Hep B. And so it kind of goes that way, right? So sometimes we'll see it in polymacrorymica, sometimes in temporal arteritis. We can even, we'll see this sometimes that in these other things, and we think it has to do with that their immune system's so low. So we can have this argument. Okay, I want to tell you a story. There's the surface antigen, there's the E antigen, and then there's the core antigen. Okay, I want you to view now, from here on in, the surface antigen is the subway. So if you were to inject yourself with IV drugs, and let's just say, if it was Hep B laced, and the Hep B went into you, what would you see first? I would see the surface antigen. I would see the subway. So the subway's showing up first. Who is coming out of the subway? Oh, this is the evil egg in the envelope. And what's inside the envelope? The core bomb. So these three pieces are working together. So one more time, let's repeat it again. And don't worry, we got a little cartoon picture come up in a second. I want you to view it this way. Who shows up first when I get Hep B? Literally, who is coming off the needle into my blood? The surface antigen. Do you have hepatitis B yet? Not yet. You see, you get Hep B when the core bomb goes off. So the surface antigen is nothing but a transport viral particle, guys. It's not inside of it, of course, is the core bomb. So the surface antigen is the transport mechanism. Who's coming out of the subway, guys? The evil egg in the envelope. What's inside the envelope, Joe? The core bomb. Does everybody see that? So one more time, repetition works, folks. Who shows up first? The subway. Are you infected? I mean, do you have acute hepatitis B yet? Not yet. Who shows up next? Who's coming out of the subway, Joe? Oh, there's the evil envelope with the egg with the core bomb in it. Again, so the E comes out, then comes the core. So now let's kind of view it this way. So who's showing up first, guys? What's the first detection of getting infected with hepatitis? It's going to be the surface antigen. That's what's showing up. So he shows up first, but is your liver sick yet? No, because the core bomb's got to go up, Joe. So he shows up first. That's the surface. That's the subway. Who's coming out of the subway? This is the evil egg in the envelope. So the egg comes out just like an egg. Think about it, guys. Imagine cracking an egg on your liver. Just crack an egg on your liver. Does everybody see how there's yolk and there's a yolk sac and there's all this goo? Does everybody see that? Just vision it in your head. What'd you do? I just cracked an egg on my liver. It's like, that's a mess. And now does everybody see how you have all this goo and how literally you could take this goo and flick it out to anybody? You're like, what do you got? I got some egg, Joe. Here, have some. So now, imagine the egg is covering the liver. This is what they're talking about, viral replication. This is when they say it's spreading. It's spreading over the liver. You get it? So who was the subway? That was just a transport mechanism. So the surface antigen was just my subway. That's all. I just got there from him. Who came out? The egg. And what happened? Look at this junk. It's like, oh my God, I got all this goo spreading all over my liver. That's the viral replication. And now does everybody see that egg with all that just goo and yunk? You could just flick it off. And now does everybody see how that's when it's most contagious? Got it? So that's the test question that rears its ugly head. Asking you about Hep B, saying, when is viral replication going on? Your story is going to go, oh, that's when I cracked the egg open, Joe. Oh, the envelope, the E antigen. Exactly. And you'll get that test question right 99% of the time. And then how's that egg? It's just spreading. It's all this goo. So what can you do with the goo? I can grab it and flick it at people. So when are you most contagious? With the E antigen. Now does everybody see how that test question rears its ugly head? Does everybody see this? Okay. And then what's coming out of the case? So there's your yolk sac. What's inside the yolk sac inside the egg? The core bomb. Once that core antigen comes out, it goes right into the hepatic cell. So this is this thing that they never explained to you in PA school, and now will make sense to you. Ready? You see, guys, the surface antigen and the E antigen are out in the serum. We can measure this. So I can measure this right here. But what happens is when the core bomb goes off, it goes on the hepatic cell. So it's in the hepatic cell, guys. Here we go. Ready? Can you measure a virus in a cell? Yes or no? And you're going to go, no, I can't, Joe. Heck, I can't measure a virus in a cell. I mean, I guess I could. I'd have to do a biopsy of the liver and then open the cell up, but that's pretty invasive, Joe. That makes no sense to me at all. I agree with you. So now does everybody understand? Do we measure core antigen? You're like, no, it'd be impossible. I mean, you could do it, but it'd be impossible. Very good. And once the core bomb goes off, right? I mean, you've got those cells are getting infected, and there goes your liver enzymes, and there goes your liver not working, and there goes the bilirubin backing up. And she's like, dude, your liver's out of commission. It doesn't work. And so now let's think about this. Just give us some thought, because I promise you, once you unlock this, everything else makes sense. Okay, you're the body. You're the human body. Hi, you've got a virus in your liver. You like this? Yes or no? You're like, oh, heck no. What are you going to do? I'm going to go make antibodies. Exactly. But which antibodies are you going to make first? Well, I got to fight. I got a war. Of course, I'm going to send my military guys. Exactly. So what shows up first, guys? Hepatitis B, core antibodies, IgM. And that's exactly what happens. So now, we're going to do it again. So who shows up first, folks? The subway. Who's coming out of the subway? The evil egg in the envelope, right? That's the envelope they talk about. What's coming out of the envelope, guys? The core bomb. Does everybody see the story? Got it? You're like, okay, it makes sense to me, Joe. I see what you're saying. So if they ask me, when am I going through viral replication? When am I most contagious? You're like, well, you cracked the egg open, man. I got all this yolk over here. It's like, does that make sense to you? What's the first evidence of hepatitis B? Oh, when the subway showed up. Okay, so what's the first evidence? The subway. Are you infected yet? Not yet. What happens next? Egg comes out, cracks open. I'm all over the liver. Does everybody see this? And then the core bomb. But here's the key point. Where's the core bomb go, guys? Inside the cell. Now does everybody see this? Now does everybody understand? It's like, can I measure core antigens? You're like, no, but I could measure core antibodies. So now, what are you going to do? You're the body. You just got hepatitis B in your hepatic cell. What do you want to do? You're like, well, I'm going to fight. What are you going to do? I'm sending the military. So what are you going to go after? I'm going to go after the hepatitis B core antibodies first. So does everybody say we're going to work in reverse? So I'm going to make the core antibodies first. What are you going to make next? E antibodies. I'm going to take care of the egg. What's the last step you're going to do? You're going to go after the subway. So let's try this again. Subway shows up, first sign of infection. Egg comes out, goo, contagious. What's coming out of the egg, Joe? The core bomb, where's it go? In the hepatic cell. But can I measure this? No. So my body's response is core antibodies, IgM. Then what are you going to go after? Oh, the E antibodies, IgM. And then what are you going to do last? The surface antibody, IgMs. And guys, what happens to your military guys in 2 to 3 months? They turn to good guys. Does everybody see this? They turn to good guys. And that's exactly what they do. So now, let's start playing with this. You see, guys, you and I got the vaccine. What did they do? So we got a series of shots, did we not? They gave us what was called an attenuated virus. What they did, guys, is they gave us the subway with nothing in it. That's what an attenuated virus means. So the viral particle is out. So they gave us a subway. So what happened to you and me? So let's just say, you got your Hep B vaccination, right? Okay. So, right. Okay. Who am I going to pick on? Oh, there's Alexis. Hi, Alexis. Just the same name as my daughter. Okay. So here's Alexis, a PA student, right? So Alexis, what happens to her? So Alexis comes to the clinic. What does she do? She gets a series of shots. What was she doing? Well, the next day, what did Alexis do? She's like, I made IgM antibodies, but here's the catch, guys. So if I was to measure Alexis' blood the next day, what would I see? Hepatitis B, surface antibodies, IgM, because she's fighting. Aha. But did they measure your blood the next day? No, they didn't, guys. When did they measure your blood? It was 2 to 3 months later because they are waiting for your M's to turn to G's. Now, does everybody see this, guys? Does that make sense? Okay, so this is what we're talking about. So you see, that was our first response. Got it? Does everybody see our first response was going to be the IgM? Then 2 to 3 months later, it's G's. And then we're good to work. We're good to go to work, right? Does that make sense to everybody? So that's what they're talking about with the vaccine. So now comes that question you hate, but now it's going to make sense. You see, guys, you and me and Alexis and Alia and Annie and all you guys, Antonio, all you guys got the Hep B vaccination. So if I was to measure you right now, you would have hepatitis B, surface antibodies, IgGs, but my IV drug abuser, he would also have hepatitis B, surface antibodies, IgG. You and I got it passively, he got it actively. How do I separate them? In other words, how do I know it's just a PA who just got the Hep B vaccination, an IV drug user over here who got it through needle exposure? How do I differentiate? What did the IV drug abuser see that you never saw? You see, guys, you never saw the core. So what can I measure? I can measure core antibodies. So that's the PANCE question. That's the PANRE question that rears its ugly head and says, hi, how do I differentiate passive versus active immunity? You're like, listen, you and I are going to have E antibodies. You and I are going to have, we're not going to have E antibodies. We're going to have core antibodies. So we're going to have neither. We're just going to have the subway. He's going to have the subway. But guess what? He saw the core. So how am I going to differentiate them? Core. Does that make sense to everybody? Okay, does everybody see this? And then last but not least, chronic hepatitis B. Okay, just come with me. Just come down the rabbit hole with me. Imagine I'm an IV drug user. So there I am. The subway showed up. Okay, I made antibodies to the subway. Okay, the subway showed up. I'm sorry. Then the E antibody, the envelope comes out. I'm jumping ahead of myself. So the surface antigen shows up first. Out comes the evil egg. Out comes the core bomb. So what did your body do? Okay, so I made core antibodies, IgM. I made E antibodies, IgM. But then just imagine, if you can, that your immune system is so tired and so weak. You're like, yeah, Joe, I made core antibodies. And I made E antibodies. But you know what, Joe? I ran out of steam. No, I ran out of, I'm tired. I ran out of steam, which means I never went to the subway. I never closed the subway door. I never made subway antibodies. That is chronic hepatitis B, guys. So when I have chronic hepatitis B, did you ever close your subway door? No, I didn't. So what's always positive in someone with chronic hepatitis B? Oh, I never closed the subway, Joe. It's still here. The surface antigen. Now, does that make sense to everybody? Now, just imagine, if you can, that subway had more than one egg. Now, does everybody see how you sometimes get the acute flare-up of hepatitis B with chronic hepatitis B because another egg ruled out? Does everybody see this, guys? Okay. So now does that make sense to everybody? Okay. So as a recap, just one more time, as a recap, okay, because I know you hate this, just as a recap, one more time. I'm an IV drug user. Who's showing up first? The subway, the surface antigen. Who's coming out of the surface antigen, Joe? The evil envelope in the egg. What happens? It cracks open my liver. It's all this goo. It's spreading. So I'm going through viral replication and I'm very contagious. What happens next? Well, the core bomb goes out, Joe, and it goes to my hepatic cell. Can you measure it in the cell? No, Joe, I can't. So what can you measure? My body's response to this. That's this. The hepatitis B core antibodies, IgM. Then I'm going to make E antibodies to the egg. Then I'm going to make surface antibodies. And all my IgMs are going to turn to what, guys, in 2 to 3 months? Gs. If I get vaccinated, and hopefully all you guys are, right? If I get vaccinated for Hep B, what did I see? I saw the subway, Joe. There was nothing in the subway. It was attenuated. They took it out. So you and me and the IV drug abuser, we both have surface antibodies, IgGs. But what did the IV drug user see that you and I never saw? He saw the core. Now does everybody see how this test question manifests itself? Now does this make sense to you guys? I hope it does. I hope this makes more sense. And then Hep B, and remember, when they say chronic hepatitis B, don't worry. He's got core antibodies. He's got the egg and the envelope antibodies. What was his problem? He never closed the subway door, guys. He never closed the subway. He never closed the surface antigen. It's still positive. Now does it make sense? And then Hep C. Man, have you seen the new antivirals for Hep C? Wow. Talk about the pharmaceutical industry doing well. This one, I'm going to give them kudos. Got it? Because back in the day, guys, when people got Hep C, you got cirrhosis cancer and you died, right? And they do have the higher risk of hepatocellular cancer. But we got all these new drugs out there. They're absolutely amazing, guys. These new antivirals, just amazing. For those who deal with hepatitis patients, knows what I'm talking about. It's just amazing. But again, we're back to my IV drug users. We used to see it in transplant recipients. We don't see it as much. We don't see it as much there, guys. So that one is like kind of a thing of the past. We've gotten much better about the transplant things, right? Still can see it in people with renal dialysis and stuff like that. But which one has the highest chance of cancer? It's Hep C. And I always say cancer starts with the letter C. Hep C starts with the letter C. Which one's more prone to cancer? Hep C. So you'll see that test question manifest itself. And then in the real world, guys, just amazing the new antivirals that we have, guys, right? That we do. They've done really, really well on this stuff. Okay, Hep D. Hep D is a dingbat. He's a ding-dong. He's an idiot. He can't drive. Who's Hep D? He's a dingbat. Have you seen him over there? The guy cannot drive, which means if he can't drive, well, then how does he get around? Oh, maybe he can hop a ride on the subway. Oh, yeah, that makes a lot of sense, Joe. I see your point. So you're telling me I'm such a dingbat, I can't drive, but I can hop in the Hep B's subway. Exactly. So that's why they often, you see, like what you memorize in school, can I have Hep B by itself? Yes. But can I have Hep D by itself? No, because he comes with B. And I always tell everybody, okay, now think about this. Now literally pull back and just stop for a second and think. I have an IV drug user. Here comes the subway. And nothing against my IV drug user, but come on, guys, we can all agree they're not the strongest dogs in the pack. So their immune system is pretty diminished. Can we agree to that? So he shoots. Here comes the subway, except he's not fighting One viral war, guys, he's fighting two. Now think about this. I have an immunocompromised individual fighting two viral infections at the liver. How do you think his liver is going to do, guys? It's going to fail. Does everybody see this? So now does everybody see that Hep D stands for death? Who's got the highest mortality rate? Oh, it's Hep D, right? We had a case. It was really sad, guys. I worked in the emergency room. We had this guy. I had seen him several times too. Right, nice guy, but long story short, bad addiction. And anyhow, so he did, and he came in, and he was in just full-blown liver failure. He was paused for Hep D. He ended up passing away 2 days later. Got it, guys? So this is it's just devastating stuff. Got it? All right. Does everybody see it? So on the boards, which one carries the highest mortality rate? Hep D. Which one carries the highest cancer risk? Hep C. Does everybody see this, guys? Okay. All right. And you'll see these questions manifest themselves all the time. And then Hep E, we see this in third world countries. We see this in China and India. And again, it's fecal oral, guys. So again, it's one of those things where it's a fecal oral thing. That's what this is, right? And then one more thing, and then we'll do some test questions here. One more thing. Okay, guys, let's just do this together, right? Okay, just do this together. And I know you hate this. All right. Remember the beginning I was telling you about the bilirubin? Remember that? Okay. Can we agree when my cells get damaged, my liver enzymes go up to AST, ALT, right? And I would say AL, L, ALT, ALT, L stands for liver. It's much more specific to the liver. AST, S, you're sloshing. So when people drink a lot, what's higher, ALT or AST? AST, they're right. They're really having a Sunday Funday. They're going at it, right? Does that make sense to everybody? But when I got real liver damage, I'm going to see the ALT go up higher because it's specific to the liver. And then you get that question, and I know you hate it, and we're just going to unpack it right here. That one you hate all the most. Oh my God. Joe, they sent me the total Billy. Then is it the indirect Billy, direct Billy? Oh my God, I don't know. I just guess, right? I know, right? I've seen all the faces. Everybody's going, oh, please don't bring this up, Joe. All right, so listen to me. Let's just do this and follow me. It'll make sense to you. Okay, when we break down red blood cells, we produce bilirubin. So bilirubin hops on the albumin bus. Albumin is your bus, guys. It's your public transportation system. So I hop on the albumin bus. I go to the liver, and once I'm before the liver, and once I've been broken down, I'm on the albumin bus. That bilirubin is called indirect, is unconjugated, it's fat soluble. Let's say this again. Before the liver, the bilirubin is indirect, fat soluble, unconjugated. One more time. The bilirubin before the liver is fat soluble, indirect, unconjugated. Open your mind with me, folks. You know when you turn yellow, you're looking jaundice. What's out in the skin? It's fat soluble stuff, guys, isn't it? So what is this? This is unconjugated, indirect, fat soluble bilirubin. Exactly. Then I go to the liver. What does my liver do? It conjugates it, it makes it indirect, and makes it water soluble, and down the biliary tree I go. So what does my liver do to the bilirubin off the albumin bus? He conjugates it, water soluble, direct. And the addition of indirect to direct, this is what we call total billy. Okay, guys, watch this. Watch this. If you can just keep that in your head, watch this. You ready? Hi, my liver's jacked up. I got Hep A, Hep B, Hep C, Hep D, Hep E, just name it. Hi, my liver's jacked. Can your liver do its job? Yes or no? No, it's not working today, Joe. Exactly. So what's going to back up in the system? Oh, wait a second. Indirect, unconjugated, fat solubility, bilirubin. Oh, wait a second. That's what's out here. Now, remember, there's still one more way out. Who's your other filter, folks? I said in the beginning, who's your other filter? Kidneys, which means, oh, wait a second, then I could pee out the bilirubin through my urine. There you go. Now we're cooking. Now does everybody see how it fits? See how this fits? It's just a story. What you guys did is just brutally memorize a bunch of facts in school, and no one kind of told you the story about the liver and stuff like that. Okay, does that make sense to everybody? And for those of you who just want to get academic with me, I'll get academic with you. When a direct water-soluble conjugated bilirubin level go up? Oh, good question. So wait a second. So my liver did its job, right? He conjugated it, right? Made it water-soluble, right? Made it direct, right? Okay, he did the right thing. Where are you going? Down the biliary tree. Oh, let's put a traffic jam in the biliary tree. Oh, wait a second. Then that stuff's going to back up. Now does everybody get it? Biliary stones, pancreatitis. Would that jack up the biliary tree? Yes. How about gallstones? Yep, that would jack up the biliary. How about an ASIN and cholangitis? Yep, that would do it too. So what's going to elevate? Oh, the direct. And you're right, guys. It's going to eventually go back out onto the freeway. And now what's going to get elevated? Oh, the indirect. See it now? Got it, guys? See it? I hope that makes more sense to you. Okay, one more time. Hep A, fecal oral, IgMs, IgG, right? So we got the vaccines and we got the immunoglobulins to this, don't we? And do we not, right? Okay. I'm sorry, Claire, I didn't see this here. So, would you not have jaundice with direct hyperbiliary? Yeah, we just talked about that. Yes, I'm sorry. Hopefully that answered your question there. Hopefully that answered your question there, Claire. And then Hep B, that's my IV drug users, right? And my sexual contact. Just remember the story. Subway, egg, core. What do? I make antibodies the opposite direction. And you and me got the vaccine, but did we ever see the core? No. But did the IV drug user do it? Yes. So what can I measure? Core. Hep B, what did you not do? Didn't close the subway door, Joe. So what's always positive? Surface antigen. Hep C, I can get cirrhosis and cancer, the other C's. Hep D, remember, not one viral war, two. I'm going to die. Does everybody see this, guys? Okay, does that make sense? And then Hep B is just fecal oral. We see this in third world countries, right? We have vaccines out there. Okay, let's do some test questions, guys, and then I'll cut you loose, okay? And then I got to go to work, right? All right, a patient wanted to be tested to see if they presently have hepatitis A. Which of the following would you order? So so they want to know if they're infected right now, like right here, right now. Got it? So you're like, okay, so I'm gonna have to order the military. So hepatitis A, oh, it's this one, 3. Exactly. What test would a PA and an IV drug abuser both have as positive? So me and you and the IV drug abuser, what are we gonna have in common, guys? And you're gonna go, well, I saw the surface antigen, he saw the surface antigen. Exactly. So that's anti-B hepatitis surface. We both have that, do we not, right? Does everybody see that, right? Makes sense? Like I said, just keep to the story, guys. If you keep to the story, you'll always do great. Which positive lab tests tell you a person is actively infectious with hepatitis B? So they're infectious. It's like they can spread it. They can throw it at you. You're like, oh yeah. When the egg opens up, because it got all this extra yolk and goo. Totally. Which of the following lab tests would a chronic hepatitis B patient have that's positive? So you're like, okay, so what did Joe see in chronic hepatitis B? He never closed the subway door. So the surface antigen is always positive. Does everybody see this? Okay, does that make sense to everybody? Sorry. Hep D, remember, he's a dingbat, he's a ding dong, he's an idiot, he can't drive. What part of Hep D? So Hep D needs what part of Hep B to get around? Remember, he can't drive. You're like, oh, let's hop a ride on the subway. Exactly. And Hep E is transmitted by which vector? And you're like, oh, it's like Hep B, Joe. It's fecal oral. Okay, that's what it is, right? What is the lab test to indicate the diagnosis of acute hepatitis B? So you're like, okay, so I want to diagnose it. I want to know that they have it. And you're like, okay, so the E antigen, that's not going to help me. So do I want to measure that? Remember, do I want to know if he's got acute hepatitis B? So you're like, did the core go off? That makes sense to everybody? Because see, you and me, we don't have acute hepatitis B, do we? So surface antigen wouldn't help us. And so it's the core. Did the core bomb go off? So now, does everybody see this? That's the question that rears its head. And what is a lab test that indicates viral replication and you're infectious? Okay, if I made my point clear, the egg cracked open, the E antigen is here. Does everybody see this? You see, so now does everybody see? You have to read the question. Are they asking about the diagnosis of acute hepatitis B, which would be the anti-B hepatitis core, because we remember can't measure the core antigen, right? Or is it that when is he viral replicating? Does everybody see this is that test question that everybody stumbles on? Always, always, always. It's right here. Got it. So remember, if it's viral replication, what happened? The egg cracked open, Joe. The egg is open. Okay. Does that make sense to everybody? Okay. So that's exactly what we're talking about here. Okay. Hopefully that makes more sense. Aha. My favorite. You're going to laugh, guys. One of the things I'm really big into is into astronomy, guys. I really am. All right. So one of the missions they had to Saturn just recently, this was the Casey, and anyhow, I came back with some really great pictures here, guys. So I am always a big fan of that. All right. So listen, guys, I hope you enjoyed this. I hope this helped you guys out a lot. Okay. But remember, what I need you to do when I deal with the hepatitis B question, guys, what have I got to do? I got to remember the story. Okay. So one more time, just as a recap, just repetition works. Okay. I'm an IV drug user. Who's showing up first? The subway. Who's coming out of the subway? The evil egg in the envelope. What is it doing? It's like an egg. It's gonna crack, and now I got all this goo and all this junk. It's just like spreading. And it's just like, oh my God, here, have some. Does everybody see this? I'm going through a viral replication, and I'm pretty infectious. What comes out of the egg, guys? That core bomb. But remember, where does the core bomb go, guys? It goes in the hepatic cell. You're the body. You're going to put up with this? Oh, heck no. So what are you going to do? I'm going to make core antibodies IgM. So how do I make the diagnosis of acute hepatitis B? Core antibodies IgM. And then I'm going to go after the egg antibodies IgM, and then I'm going to go after the surface antibodies IgM. And what happens to all my antibodies in 2 to 3 months? They turn to Gs. Right? You and me got vaccinated. We saw the subway, but we didn't see the core and the egg. We didn't see any of that. But my IV drug abuser did. So when they asked me, hi guys, can you please explain to me how do I differentiate passive, that's me and you, versus active? And you're like, oh, this guy saw core. You and me didn't see core. So I could order core antibodies, IgG. Exactly. Remember, Hep C stand for cirrhosis and cancer, right? Hep D, dingbat, ding dong, can't drive. What's he got to do? Hop on the subway. So what part of Hep B what Hep D needs what part of Hep B? That's the surface antigen. Remember, that's an IV drug abuser, a person with not the strongest immune system in the world. So he's not fighting one viral war, he's fighting two. What's going to happen? He's going to fail, guys. He's going to die. Got it? Does that make sense to everybody? All right. Does that make sense to everybody? All right, guys. Well, listen, I enjoyed being with all you guys. It was great meeting everybody. I will see you guys back in a couple Sundays, and it was enjoyable, guys. Welcome to the garage, and I will see you guys soon, guys. Take care, guys. Bye, everybody. Bye, guys.